Hip dysplasia. The first step to recovery is knowing there's a problem. Know what to look for and how to keep your furry friend's hips moving. Hip dysplasia is a common disease in large breed dogs and sometimes small. The disease affects the skeletal structure. This is when the hip joint does not develop properly. The ball and socket do not line up with the result of grinding. Some common breeds affected by this disease is the German Shepherd, the Rottweiler, the Golden Retriever, the Saint Bernard, the Labrador Retriever, and so many more other breeds. Some clinical signs to watch out for are stiffness, difficulty to run, jump, or even get up, decreased activity levels, little range of motion, lameness in the hind end, a bunny hopping gait, loss of muscle mass, and favoring the hind end. During the diagnosis, your vet will do a physical exam. Sometimes this is enough to tell if they have severe hip dysplasia. During the physical exam, the vet will look at the flexibility of the joint. They will manipulate the leg to see how loose it is, if there's any grinding, pain, or limited range of motion. Along with a physical exam, x-rays will be taken to determine the severity of the dysplasia. There is no cure for hip dysplasia. There is supportive care and physical therapy available. Swimming or exercise on soft surfaces such as sand, weight loss, non-steroidal anti-inflammatory drugs, supportive harnesses, and sometimes even surgery. There is no way to completely prevent hip dysplasia, but there's ways to slim the chances of getting it. Starting your pup off on a healthy diet is key. The appropriate amount of exercise is essential for their growing bones. You can give supplements if needed, and OFA testing for breeding healthy puppies. Every year, there's tons of hip dysplasia cases reported in Canada. This is one to help you understand the severity of this disease. A 2.5-year-old male lab was presented with a history of an abnormal gait, difficulty to jump, and lameness in the hind end. He did not like stairs nor exercise. With the history of the dog, it was suspected hip dysplasia. Upon the physical exam, there was pain in the hip joints, narrow stance, and little range of motion. X-rays confirmed the diagnosis. They sent the dog home with medications to help with pain and movement. The owner was advised to provide little exercise and keep him on a non-slippery flooring. After only 15 days of treatment, they started to notice a difference in the dog getting better. Talk to your vet today for more information on hip dysplasia and keep your pup's hips moving.